Green means you can go, right? So you have sensory stimulation, visual. But one sensory stimulation means one movement, another sensory stimulation means another movement, right? So for this type of intellectual functions, premotor cortex is important. Without the premotor cortex, this one is not possible. Okay? So premotor cortex has two parts, anterior part, posterior part. Anterior part is mainly involved in the generation of the motor image. So for any movement, we can have a pattern. I mean, a timeline, maybe, okay? Or for example, we can think of a plan or a program for performing that movement. Which muscles should be activated? Which one should activate at first? Which one should be contracted last? Yeah? So this pattern of movement is controlled by the premotor cortex. The posterior one is mainly involved in the execution of this motor image. So at the anterior side, we generate a motor image, and the posterior part, this motor image is performed by the premotor cortex. So I told you that premotor cortex is involved in some complex movements. You can see that in this monkey, stimulation of one point may cause one movement. Stimulation in another point may cause another complex movement. So these actually are the examples of complex movements. I mean, involving several joints, several muscles, right? So we call them stereotypic movements or complex movements. So, and this figure shows the guiding of the movement based on the sensory stimulation. So let's see this. In this monkey, you can see that the monkey is observing the monitor. You have a signal for movements in the right arm, right? So we have two signals here actually. One, which is a arrow like this, that means the direction of the movement, and the other stimulation is the go signal. I mean, now you're allowed to do this movement. So a monkey is observing the monitor, right? We will give the monkey two signals. The first signals actually signify the direction of the movement, right side or left side. So the monkey actually is informed about the intended movement. But at this level, at this phase, the monkey is not allowed to do this movement. We need the second stimulation in order to allow the monkey to do the movement, right? Yeah. So, when we prepare for movement to the right, this neuron is activated, but during the movement is not active. Again, when prepared to the left, this neuron is activated, but during the movement, it's not active. What does it mean? It means neurons in the premotor cortex are activated when we plan for a movement, not when we do a movement. Okay, do you want to see this again? Okay, so the movement is divided into two segments now, right? One segment is happening at the time of planning. Another segment is happening at the time of performance. So we have a neuron here which is only active in the planning phase, not in the execution phase. You can see this again. So we give the signal, prepare to move to right. So this neuron is active. But when movement starts, the neuron is suppressed. Prepare to move left side. The neuron is active, planning. Now movement starts, neuron is inhibited. So you can compare this one with another neuron that we have seen in the primary motor cortex. In the primary motor cortex, the neuron was active when we wanted to start the movement. So the neuron was responsible for movement itself. But here we have a neuron that is inhibited during the movement, but it's very active some seconds before the movement. So this means that neurons in the premotor cortex are more important for planning of the movement, but neurons in the primary motor cortex are more important for performance for performing the movement. Got it? Okay.
The monkey move with the right hand, the signal with the left, the molecule.
Yeah, movement to the right and to the left by one arm, not the other arm. Yeah, one arm. So the signal shows the direction of the movement, this side or this. So in order to teach the monkey to do this, you need 1 or 2 years of practicing. So after 1 or 2 years of practice, the monkey learns that this signal means this movement, and that signal means this movement. Okay? 2 years, maybe 3 years, they need for practicing this. So another thing about the premotor cortex is that there are some neurons here that are very special. Okay? We call them mirror neurons. You know mirror? Yeah? You stay in front of mirror and you can see yourself, right? So remember that in the primary motor cortex, thank you. خیلی ممنونم از شما. In the primary motor cortex, neurons were involved in performance of the movement. Do you agree with this? So, for execution of the movement, primary motor neurons are important. For planning of the movement, premotor neurons, right? And also supplementary, okay? But there are other neurons in the premotor cortex that are involved in planning of a movement when you want to do this movement yourself, or when you observe somebody else is doing that movement. Got it? So we call this mirror neuron. So for example, I do this movement. Okay? So for doing this movement, some neurons in my premotor cortex should be activated before the movement. When I plan for this movement. Right? So these neurons are activated. But there are also other neurons that are activated for this movement. But these neurons are also activated when you do this movement. When I observe that you are doing this. You know this? So we call this mirror neurons. Mirror neurons are active both by performing a specific action or by observing that specific action that is being done by another person. Right? So it's important for understanding the movement and for learning of movement. So for example, when I do this movement and drink it, you can understand what I'm doing now. You can imagine that you are doing this movement. Okay? So you can understand the movement, you can learn. For example, you go to the hospital and you want to learn how to inject something into the vein of a patient. So at the first time, sorry, it's here. So in the first time, you won't do the same. I mean, you won't do the action by yourself. You should observe, and you should learn little by little. And after several times of observation, you can do that. Okay? This is the function of the mirror neuron. So by observing of the action of other people, we can learn that action. Okay? So now let's see an example here. There's a monkey here. So we have some neurons in the premotor cortex, and we are recording the action potential generated by this neuron. So the monkey is cracking a peanut. Okay? So the monkey is performing the action. In the planning phase, this neuron is activated. But we are recording the same neuron, and the monkey observes that a person is doing this, cracking the peanut. So the monkey only observes that. The same neuron is active. Another case, the monkey cannot observe it, but it can hear that somebody is cracking the peanut. Okay, because the sound signifies the cracking of this peanut. Again, this neuron is active. So, performing an action, observing an action, hearing of an action has the same meaning for this animal. Right? So the same neuron is activated. So we call this mirror neuron. They are located in the premotor cortex, and they are important for understanding of a movement and learning of a movement. Okay, so let's skip this one and go ahead because we don't have enough time. So in the premotor cortex, we have some sub areas. So in the inferior frontal gyrus, we have Broca's area, responsible for motor aspect of language. So when we talk, this part is activated, so we can talk with this part. We will see this in your last session. Okay? Above this, we have an area related to the eye movement. So voluntary eye movement. So when you voluntarily move your eyes and see, for example, this person, and then you change your view and see another person, so your eye movement is controlled by this area of the brain. When you do this voluntarily, when you do this purposefully, right? But there is another area in the brain here, eye fixation area, which moves the eye involuntarily, right? So everything happens here involuntary. So voluntary eye field, involuntary eye field, frontal eye field, occipital eye field. We have head rotation area, which is very close to the eye movement area. So this close proximity causes relation between the head movement and eye movement, right? Hand skill area, related to skillful movement of the hand, okay? If there is damage here, in the Broca's area, the person may understand the words, but may not be able to produce any word. The person can understand you when you talk to them, but he or she is not able to talk fluently, right? We call this Broca's aphasia. We will see that later. Damage here in the control in the voluntary eye field or in the frontal eye field may cause locking of the eyes on some specific objects in the visual scene, and the person cannot move the eyes. Okay? So eyes are involuntarily locked on some specific objects in the visual scene. So the person is not able to unlock the eyes. Okay? In order to unlock the eyes, the person should close the eyes, open it again, then the eyes are locked onto another thing. Okay? So, head rotation area, okay, hand skill area. Any damage here may cause difficulty performing some specific actions voluntarily. For example, you may ask the person to show you how they brush their teeth. Okay, the person is not able to show you, right? Or you may ask the person to show you how they comb the hair. Okay, but the patient is not able to do that. But when the person is at home, and want to comb the hair, they can involuntarily comb the hair. But when you ask them to show you, to imitate that, the person is not able to do that. We call this apraxia. Okay, you cannot see the word here because it's here. Okay, so apraxia. So columnar arrangement of the neurons. So primary, premotor, supplementary motor area neurons are arranged in some columns. You know that in the cortex we have 6 different layers. Superficial layer is called molecular. Then we have outer granule cell layer, outer pyramidal cell layer, inner granular cell, inner pyramidal cell, well, polymorphic. Okay, so we have 6 different layers. So there are morphologically different cells in these layers, right? So if you see them under the microscope, you can see these 6 layers. But the same areas of the cortex have also some columnar organization. So layers are located like this, horizontally, but columns are located vertically. You can imagine the cortex as having several millions of these columns. So in each column, you have 6 different layers, right? There is no boundary between these columns. So in each column, you have some neurons in the molecular layer, some in the outer granule cell layer, some in the outer pyramidal cell layer, and so on. And each column is mainly involved for a specific function or for a specific movement. So at the beginning of this class, I told you that neurons in the primary motor cortex are involved for some specific movements, not for some specific muscles, right? So let me correct myself. Each column of neurons is involved in one specific movement. So all of these neurons play together in order to do a specific movement. And the nearby column is involved in another movement, right? So in each column, we may have several thousands of neurons. All of these neurons can function together in order to do a specific movement, right? So they can serve as a unit. They have integrative processing, so they can combine signals together. They can amplify each other, right? And in each column, we may have 2 different sets of neurons, dynamic neurons, static neurons. Dynamic neurons are involved at the beginning of a movement. So when they are activated, they cause initiation of a movement. But static neurons can maintain the signal or can maintain the contraction. So at the beginning of a movement, dynamic neurons are activated. When the movement is going on, static neurons are active, right? So the connection of the motor cortex with the body is by way of the corticospinal tract. You know this, right? It originates from primary motor cortex, premotor cortex, supplementary motor area, and also from the somatosensory cortex. So this is very important to know. Somatosensory cortex is the termination point of the DCML system, dorsal column medial lemniscal system, important for touch, vibration, pressure, and so on. Right? Somatosensory area is also the termination point of the spinothalamic system. Important for pain, temperature, I don't know, age, tickle, everything, right? So this system is sensory. It's related to sensation from the whole body, skin, joints, muscles, bones, right? But the same area also sends neurons down through the spinal cord in the corticospinal tract. We don't know the function of this. Why this area, which is pure sensory, should send neurons to the spinal cord. Maybe it's a matter of feedback regulation of the upward sensory system. I mean, the brain may decide about which sensation is allowed to come to the brain, which sensation is not allowed to come to the brain. Maybe this is the function. Or maybe it has really some functions in movement. Okay? So, anyway, corticospinal tract originates from these areas of the brain. 40% of neurons originate from the somatosensory areas. In the medulla, we have cross of the fibers, right? 80% of neurons cross here in the medulla and they generate pyramids. So that's why we also call pyramidal tract, right? 20% of neurons do not cross. So they go down on the same side, ipsilaterally. So from here we have two corticospinal tracts. Lateral corticospinal, medial corticospinal. Right? The lateral corticospinal tract is defined in the lateral system. They are related to the movement of the distal part of the body. But medial corticospinal tract is defined as a medial system, important for movements of the proximal part of the body, axial musculature. Right? Okay, corticobulbar tract originates from the cortex, go to the brainstem, and activate cranial neurons or cranial nerve nuclei. Not all nuclei here, actually. Nuclei related to trigeminal nerve, nerve number 5, facial nerve, number 7, hypoglossal, 11, right? 12, spinal accessory, 11. So this is for chewing and mastication. This one for facial expression, right? This one for the tongue, and this one, sternocleidomastoid, right? This movement. So these movements are controlled by this pathway. Okay. Cortico-rubrospinal tract starts from the cortex, go to the red nucleus. From red nucleus, neurons go to the rubrospinal tract. Red nucleus has two parts: magnocellular, parvocellular. Parvocellular has small neurons, magnocellular has large neurons. Rubrospinal tract originates from the inferior parts, magnocellular parts, right? Neurons from here go to the opposite side, then go down. Corticospinal tract, corticorubrospinal tract. So, lateral corticospinal tract is important for movements of the fingers and the toes and the lips, right? And rubrospinal tract is also important for movement of the fingers and wrists, the distal part of the body, because they are in the lateral system. So, for movement of the fingers, we have two parallel systems: corticospinal, rubrospinal. So when there is damage in the cortex, right, in the hand area, after the recovery of the patient from that damage, some of the functions of the finger come back. Okay, so at the acute phase, when there is damage in the cortex, all movements of the finger is lost. The person is not able to move the hands and fingers. So we call this paralysis, right? It's flaccid paralysis. The muscles are relaxed, so there is no control over the muscles, right? Actually, this one is contralateral. If there is damage here, this hand is flaccid. If damage is here, this hand.
It's considered upper motor neuron or lower motor neuron?
Upper motor neuron.
So we have the agility and pace processing.
Yeah, in the late phase, not in the acute phase. In the acute phase, we have flaccid paralysis.
Because it become more contraction, more active.
Yeah, this one happens after some days, after some weeks. Okay? In the first day, during the hours of the damage, we have flaccid paralysis. The muscles are totally relaxed. There is no contraction in the muscle. There is no tone. But after a while, we will have hypertonia in the muscles, right? But for fingers, because we have also red nucleus for movement, gross movements of fingers come back. The patient will be able to move the fingers grossly, I mean all fingers at the same time, like this. But the person cannot move fingers individually. Okay? So individual movement of fingers is a function of the corticospinal tract. Yeah. So by the rubrospinal tract, the person can only do this, gross movement. Okay? So the patient is not able to do this, or play piano, or write something. Okay? Yeah. Fine movement. Yeah, is lost. So, okay, I mentioned this. And these are also other pathways from the motor cortex. Some go to, I mean, besides the corticospinal tract, we have some other neurons from the motor cortex that go to the basal ganglia. Some other go to the red nucleus, rubrospinal tract. Motor cortex can also activate pontine nuclei, so it has some connections with the pontine reticulospinal tract. Motor cortex may also activate medullary reticulospinal tract and also may send neurons to the reticular formation. And then we will have reticulospinal tract, reticulocerebellar tract. Some neurons may go to the vestibular nuclei, so they can influence vestibulospinal tract, vestibulocerebellar tract. Some other neurons go to the inferior olivary nucleus, and then from here they go to the cerebellum. We will see this in the next session today. Okay? So, although we have some neurons in the reticular formation related to posture, right? Pontine was excitatory, medullary was inhibitory, remember this, right? But all of these are under the control of the cortex. So the motor cortex can cancel their function or can exaggerate or can enhance their movement. The vestibulospinal tract was important for balance. When we are out of balance, the vestibulospinal tract is activated so we can regain our balance. But the same system is also under the control of the motor cortex. You can deliberately change the action of this system. So all of the descending pathways are under the control of the cortex, right? So I think that's, yeah, this was the last slide. So we have 20 minutes.
Mainly have go from front to the cortex again, and the cortex then
Both ways, from subcortical areas, I mean from the brain stem, from the spinal cord to the cortex, and also from the cortex to this.
just to make it in order. Cortex sends some signal to the other tracts,
Yes,
brain and brain. Maybe sometimes we have exaggeration in this stimulation. Some part of the brain, for example, thalamus and the basal ganglia, for example, will send the feedback signal for modulate this.
yeah, they can influence the action of the motor cortex. So motor cortex can influence actually lower centers. Lower centers can send feedback to the brain, so the brain can rectify or can correct the signal.
This is in cerebellum, right? Yes.
Cerebellum, basal ganglia, all other areas.
For the movement of individual finger related to primary motor cortex.
Finger,
Finger.
yeah, primary motor cortex, yeah. Primary motor cortex, hand area.
I think premotor cannot move finger individually.
So I told you, for planning of the finger movements, We have a special area in the primary.
Premotor just rest shoulder and
No, 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 it's not the same. It's not this. In the premotor cortex, we have hand skill area, right? So in the primary motor area, we have an arm area. It's here, okay? So it's neurons here are important for performing an action by the arm. But neurons here are important for planning of this movement. Got it? Mainly planning. Yeah, planning and programming of the movement. And there are also some other neurons in the supplementary motor area important for planning of the sequence of movement. Okay? So for any movement, all of these areas should be activated at the same time. Supplementary motor, premotor, primary motor. So one determine the sequence, another one determine the plan, another one perform the action. So all of them should be activated at the same time. There are a very complex interplay between these areas. And also somatosensory cortex should be activated at the same time. So let's